How to be a successful doctor of medicine in the United States of America, considering that you were born and raised outside of this country. And what are the challenges the doctors are faced during this pandemic? Our guest is currently a faculty member, a clinical assistant professor in the Division of Endocrinology, Diabetes, and Metabolism within the Department of Medicine at University of Wisconsin-Madison. He received a lot of recognitions and awards, and he is a graduate of University of the Philippines. Let us all welcome one of the many pride and joys of the Filipino community in the Madison area, Dr. Kenneth Patrick Ligaray. Hi, Dr. Ken. Welcome to Global Inspiration.
Hello, Jeanette. Thank you. It's an honor for me that you invited me to your program. So I'd like to say hello to everybody, your viewers, your subscribers. I hope everybody is staying safe and healthy at this time.
Thank you very much, Dr. Ken. Before proceeding to the main interview, I would like to remind our viewers to click on the subscribe button as well as the bell button so you will get a notification every time a new video is being released. So my next question to you, Dr. Ken, is how long have you been practicing medicine in America?
So I came here in 2002, shortly after medical school. So I did residency training for 3 years in the Chicago area and then fellowship for 2 years in Missouri. So this is probably, in terms of practice, this is probably my 14th year of practice.
Okay. So do you have any family? Is your family with you here in America?
Yep, my wife, Vita, and we have 3 kids. The oldest one is almost 12. And we have a 10-year-old and an 8-year-old. That's a girl, a boy, and a girl.
So I would say that you really love medicine. And I am curious if there are any family members who are also into this field. Are you just alone or just share with the viewers?
Well, Jeanette, I come from a big family. I'm actually the youngest of 12.
Oh my gosh, that's a big family, but it's okay. It's okay.
Of those 12, I have 4 sisters and the rest are brothers. The sisters, 2 of them are nurses. So we have people in the medical field. One is a midwife and another one is a medical technologist. But turns out I'm the only physician from that family.
Yeah, congratulations, Dr. Ken. So you were born and raised in the Philippines, and I'm proud to say that you graduated valedictorian in high school and cum laude at the University of the Philippines, and you rank and a licensure medical exam 4th all over the country. So I am curious, and the viewers are curious, did you practice medicine in the Philippines before you came to America?
So for a very short period of time, after I took the boards in the Philippines and before coming here for training, there was a time there that I was able to do some what we call moonlighting.
Correct.
We work for a hospital and man the hospital while the attending physicians are somewhere. So that's what I did, maybe for a few weeks.
So you were practicing medicine in USA, and the latest is that you were a medical director with Meritor, right, in the field of endocrinology.
That's right.
Yeah, and now you are the clinical assistant professor at UW Madison. What prompted you to move from the Philippines to United States?
So the story is right after med school, I came to the States as part of the College of Medicine choir. It was a concert tour.
Okay.
We were hosted by our alumni, so we went to a few states to perform. And these alumni inspired me to come and train here. So that's one. So I took the boards and came here, applied, and got residency program spot. The other half of the story is that 2 of my sisters, those nurses that I talked about earlier, they're already here. And when I finished medical school, my parents also have migrated to the United States. So it was not a difficult decision for me to come here.
Okay, that's good. And it's good to know that it's not only you, that you have family members that are also into the medical field, and in a family of 12.
Yes.
So you've been in America for 14 years as far as the medicine is concerned, as far as
Practice, yes.
practicing, as well as, as far as practicing. But you've been here in 2001, correct?
I came, 2001 is when I came for that concert tour.
Oh, okay, okay. So I would say you love America. So what are the two things that you love about America and practicing medicine here?
Two things. One is cutting edge research. So we learn about new things that we can translate to clinical practice for the benefit of our patients. That's a really good thing. The other one is availability of resources, whether it's for diagnostic or therapeutic purposes, it's easily available for our patients. So we expect better outcomes if we have those and they are available.
Yeah, and there's two reasons why you are practicing here, medicine here in America. Is not, or if you compare that to the Philippines, although we are almost there, but I would say we are not yet there. It's so advanced in United States of America. So I
Correct.
would, yeah. So when I learned that you are in the field of endocrinology, it comes to my one ear and gets to my other ear because I have no idea what endocrinology is. So as you are concentrating on this field, can you explain to the viewers and to me what is endocrinology? What is this all about? I know it's a medical term, but that's it.
Right. So maybe one word to remember is hormones.
Okay.
So endocrinology is a branch of medicine that takes care of people who have problems with their hormones. Maybe
Okay.
there's lack of hormones or too much.
Okay.
And we also deal with problems of the glands that produce these hormones.
Oh.
So the biggest insulin is a hormone, which is a big issue in people with diabetes. So we see maybe 70% of the time people with diabetes under our specialty. And maybe
Oh.
you're also aware of thyroid gland and pituitary gland and adrenal glands and estrogen and testosterone. Those are under the field of endocrinology.
So I understand that you are a clinical assistant professor in the division of endocrinology, diabetes, and metabolism, and it now makes sense. It talks about diabetes and the glands. So
Correct.
how do you see this field 5 or 10 years from today with the aggressive development of technology? 5 to 10 years from now.
You're totally right. So the past 10, 20 years, there's been a boom of developments in terms of care for patients in the endocrinology specialty, especially diabetes.
Oh my goodness.
We have so much better ways of delivering insulin. I don't know if you've heard about insulin pumps and continuous glucose monitors. We are now able to check blood sugars without needing blood samples or pricking your fingers.
Oh, that's good.
And remotely, we are able to manage, especially in this time of the pandemic, we're able to get data from patients. They upload their data in their computer, and then they are linked to our office. And without them having to come to our office, we are able to get their blood sugars and make changes to their medications.
The beauty of technology, right? So, because of pandemic, because of COVID, can you share with the viewers how is COVID affecting the field of endocrinology? Did I pronounce it right? Endocrinology or the medicine itself?
It has greatly changed the way we practice.
Okay.
For one, people who have diabetes are at increased risk of getting the severe form of COVID.
Okay.
So we are very careful. We encourage our patients to really keep their blood sugars under control so they decrease that risk.
Okay.
The other one is even in other fields of medicine, we have to improvise
Okay.
and go to telehealth medicine for a lot of our office visits. Fortunately, things are somehow getting back to normal. More and more patients are coming into clinic now. but those who are at very high risk of getting COVID, or those who are still worried that they might get it, we still do video calls like this with our patients, or even telephone calls.
I know a lot of people and a lot of fields are affected all over the world, not only in America, but all over the world because of pandemic, because of COVID. And people are so flexible to adjust what is in front of us or what life has offered us. So I understand that Dr. Ligaray is very active with the professional field, professional organizations. Can you share with us if you are, or if there are any other organization that you are a member in Madison, or do you do some volunteer work that is not medical related?
Well, first of all, on the list is Pamana.
Thank you.
So my family is a member of the Philippine American Association of Madison and neighboring areas. And if I remember right, Jeanette, you were the president when we joined the group.
Yeah, thank you.
So you have a lot of projects that sometimes we get involved in. I know there's a scholarship program that
Correct.
we support as well. And then there's a local church that we are affiliated with.
Okay.
It's in Fitchburg. And one of the projects that they do is to provide and prepare food for people who are not able to provide for themselves, the poorest in the community, so we say.
Oh, that's good.
So we help out in providing and preparing food, especially in this pandemic times. They need volunteers, so we get involved. There's also a local church. It's a Filipino church in Plainfield, Illinois, that we also affiliate with.
Oh,
And with that, we were able to go to the Philippines for a medical mission.
that's good to know that you are involved not only in the professional field, but also as far as locally, you're involved with that. I know that you have a good voice because you're a member of the UP Med Choir. But I am curious, you are busy, you're all over the place. What do you do to give your family a break? Or I would say, what are your hobbies?
I'm at home and I have time, I cook
Oh,
or bake. Yeah, don't tell my diabetes patients. I like to cook and bake. And well, I still try to sing when I can. With the current technology, we're able to do music, choral music by recording, and then somebody stitches them for us. We do that at church as well. But if it's for the whole family, we like to travel. Even locally, we go to towns that we haven't seen before, see how nice these little towns are, explore places. Yeah. In Bisaya, Laagan.
yeah, yeah. Just roam around. So I know you are active in America and also in your local town. I am curious to know, when was the last time you visited the Philippines?
August of 2019.
Oh,
It
okay.
was a quick visit.
Yeah.
I have my mom's aunt. She was the grandmother that I know growing up. She turned 100 the year before that, and then August I had to go home. She passed, but to celebrate her life,
Yes.
decided to go home. 100 years old. I think
Okay.
that's a very good age.
I know it's 2019, it's just like almost 2 years ago. But what are the things that you miss most about the Philippines? Why do you want to go back, except having your family there?
I miss the people. I miss connecting with friends and family, our classmates from before. Vita, my wife and I, we went to the same high school.
Ah, okay.
So, so we are very close to our high school classmates, former teachers. And then another one that I miss would be traditions. Like we celebrate Christmas differently. Even the Holy Week, the quietness and the observance is different. And there are, I think being involved in certain milestones of people that are close to you, it's good to be there as well. Like when your friends get married or they have children getting baptized, or
Exactly.
even friends who pass away, I think it's good to be involved and be there when those things happen. And I miss all those things.
Yeah, just like me, I miss going back to the Philippines. I usually take a 2 or 3 week vacation, but I miss my family and my friends in the Philippines. Dr. Ken, I appreciate the time that you gave to Global Inspiration. You know, we know you not only as a doctor, not only as a professor, we better know you as a friend, as a father. And before we part ways, I would like to ask you the last question. Can you share with us any inspirational thought regarding life experiences or the virtues that you practice or anything about the future?
So a lot of learning while living, right? But
Yeah,
I will share about 5 items to
good,
everybody
good.
that helped me um, survive kind of until now. So the first one is a verse from the Bible that I learned as a little kid, and I keep it in my heart. And that's Proverbs 3, 5, and 6. And it says, "Trust in the Lord with all your heart and lean not on your own understanding. And in all your ways acknowledge him, and he will direct your path." The second thing I'd like to share is that I have learned that second chances do not always come.
Oh,
So the first time an opportunity comes and you really wanted it, I advise you to jump on it because it might never come again.
correct.
Number 3, we have to keep dreaming and work hard to make our dreams a reality. Like I wanted to become a doctor and now I'm a doctor. What's next? I have to dream some more
Correct.
to get somewhere. It doesn't stop. Number 4, worrying does not help. So I advise you not to waste your time and emotions worrying because it's just not worth it. And the number 5 item that I want to share is having been to the States and having met people from different beliefs, backgrounds, different ways of life, always choose kindness. They're different. You don't always have to conform, but you can always be kind. And
Yes.
I think it's a very good thing.
Yeah. And I want to say something about what you shared with us. Kindness comes to heart. We're only given one life, and all you can do most of the time is to be kind. When we die, we will all be the same color. We will all be skeletons. So just be kind. And I also like when you say, now that I'm a doctor, what's next, right? So I'm now in America. What's next? So continue on dreaming. And and I agree with you. And I also tell this to my friends, worrying does not help. It is just something that sucks your present and your future because you're worrying too much. And I tell my mom is a warrior. Like
Uh-huh.
I keep on telling my mom, don't worry, it will or will not happen, or maybe not now, but do not spend more time. Again, Dr. Kenneth Patrick Ligaray, thank you very much for the time. And in Global Inspiration, we featured people like you. Global Inspiration, where you need to be seen, need to be heard, and be an inspiration to the world.